Why are vulnerable populations treated differently in trials? Have you ever wondered why certain groups of people are treated differently in clinical trials? This question is important as it touches on the ethical considerations for patients and their journey in trials. Vulnerable populations, such as children, prisoners, pregnant women, elderly individuals, and those with cognitive impairments, often face unique challenges. These groups may be more susceptible to coercion or harm, which is why special care is taken when involving them in research. The primary goal is to protect their rights, safety, and overall well-being. Ethical guidelines requiring that researchers take extra steps to ensure that participation is truly voluntary and informed. For example, children cannot provide consent on their own, so parental or legal guardian permission is necessary. Similarly, prisoners must not feel pressured to participate due to their circumstances. The need for these protections stems from historical abuses in research. In the past, many individuals were subjected to experiments without their consent. This led to the establishment of ethical principles like informed consent, respect for persons, and fairness in research. Vulnerable populations are at a higher risk of exploitation, so trials are designed to minimize these risks while still allowing for their inclusion when appropriate. However, it is also important to note that excluding vulnerable groups from research can create gaps in medical knowledge. For instance, if pregnant women are left out of trials, we may not fully understand the safety of medications during pregnancy. Therefore, modern approaches aim to include these populations while ensuring their safety through tailored communication and additional oversight. For patients considering participation in trials, it is essential to understand that if you belong to a vulnerable group, there may be additional steps to ensure your safety. Researchers often provide extra counseling to explain the trial and its risks clearly. Some trials may exclude certain vulnerable groups if the risks outweigh the benefits, while others may specifically include them to address their unique health needs. Ethics review boards play a vital role in overseeing trials to ensure that vulnerable participants are not coerced and that their participation is voluntary. These boards help maintain the integrity of the research process and protect the rights of all participants. In summary, vulnerable populations are treated differently in clinical trials to safeguard them from harm and exploitation. This careful approach balances the need to include these groups in research to improve medical knowledge and care. Understanding these ethical considerations can help patients make informed decisions about participating in trials.